So let's talk about a few best practices here. All right. So dedicated hygiene assistant. We recommend this from the start during the times that are scheduled as assisted hygiene. So for example, if you start this out on Tuesdays, you want to have that everybody understanding that that hygiene assistant is dedicated to hygiene on that day when they're working out of two rooms. This doesn't mean that the dental assistant is standing around, during this time, I'm looking at this maybe 9:30 to 11. They're part of the team. They're doing the regular things that they're always doing. They're training with the hygienist. They're listening so that they can get in sync with the hygienist. They're calibrating their messaging. They're working on the schedule. They're helping with sterilization. They're being a strong part of the team. And if everything is good in hygiene and it's trucking along and everything's caught up, then they can go help in other areas as long as they can be back when that next patient needs them and when that hygienist needs them. So we do not recommend that you have this person as a floater because they often ended up being pulled into um, cases or situations that end up taking a long time. And then the hygienist is kind of struggling because they don't have that partner to care for those patients. And that can be really frustrating. Second best practice is start slow. As you can see in this template, this is only adding a few extra patients into the schedule in the morning and then again in the afternoon, just to start, right? Just start slow, get it started, feel really good about where you are with that, and then you have the opportunity to add more if that's your choice. It gives the assistant and the hygienist ample time to work on patient flow and implementation. Next is pre-plan. Planning the day is 100% critical, right? If you just show up at the last minute, it's going to feel chaotic. So prior to the start of the day, the flow is discussed in detail about where each team member will be and where they should ideally be working, and knowing that that is likely going to change and evolve over the day. But really pre-plan that day and make sure you know all the procedures that that patient has the opportunity to complete that day. Is there any incomplete treatment, for example, sealants on a child or something like that, that you can go ahead and recommend and potentially complete that day. High touch. So keep in mind that you're offering your patients the best high touch service that you can. So with proper patient education, they'll see that patients are familiar with a multiple provider model, right? When you go to the doctor, the doctor doesn't typically, show up in the reception area to bring you back to, the clinic room. It's typically a medical assistant is bringing them in. They're taking their vitals. They're asking about their medical history. They're asking about their chief concern for the day. And so patients are used to that. And they're used to being able to have conversations with more than one person. So I know a lot of times we have such close relationships with those patients that we get a little nervous about sharing that, but it's really an advantage when you can do that. Also, think about those times when you need to step away from the patient. Now they don't have to be alone. Also, maintaining proper appointment time. We already talked about this, but that is one of the best practices. And again, shortened appointment times lead to feeling rushed. And honestly, what we see is there's very little diagnosis. So it's really kind of defeating the purpose. Yes, you're getting patients in for, the quick prophy if you're on a back-to-back-to-back 30-minute schedule, but that's not really what's in the patient's best interest. It really is having a very thorough hygiene exam that really identifies what is the patient's conditions, what are their concerns, and how can we best serve them. So maintaining proper appointment time allows you to do that. And certainly not last, but last on our list for today is the handoff documentation and just general handoff communication. There are going to be times in assisted hygiene where the assistant is handing off to the doctor for the exam. There are going to be times when the hygienist is handing off, or they're going to be handing off to each other. So have some type of documentation that you can write things down if somebody has to, move on to the next patient. Maybe you have some communication, but it doesn't happen to be able to be right in front of the patient right then. But make sure that there is someone in there to hand off to the doctor when that time comes, so that the patient knows that they're cared for. And I mean, again, think about when you go to the doctor's office, how frustrating is it when you have to explain your whole situation all over again, right? When you're like, I just told this person that, and they typed all these notes, but either didn't say anything about that or the doctor didn't have a chance to read it. So absolutely, we advocate for doing the very best, have somebody, whether it's the assistant or the hygienist, to hand off to the doctor so the patient doesn't have to repeat all those things.